Okay, in this video we're going to talk about how to manage acute anterior hip pain. So you have this pain in the front of the hip that just won't go away. Maybe you feel it when you bring your leg behind your body, especially when you walk for prolonged periods of time, or even when you compress the knee to chest, you feel this pinching type sensation. Now oftentimes this is irritation to the front of the joint capsule and the ligaments that make up this joint capsule. Now, most of the time, I'm a huge proponent of using mobility work and end range strengthening type movements to heal the body and address pain problems. But any good mobility coach, or pain specialist for that matter, should know when mobility is not an appropriate intervention and when it can actually make symptoms much worse. Oftentimes, if you have irritation to the ligaments in the front of the hip, then stretching exercises for the front of the hip will probably be making it worse because you're just tugging on that connective tissue that does not want to be stretched at this moment. Also, I tend to prescribe exercises that mobilize the posterior hip capsule for anterior impingement, so the femur has space to glide back in the socket and improve that hip flexion so you don't feel so bunched up at the front. But if there's some acute inflammation and sensitivity in that front of the joint, then doing hip capsule stretches like this, especially with an anterior pelvic tilt, where you're taking up slack from both the pelvis and the femur into hip flexion, can actually irritate and further compress those angry tissues that do not want to be compressed or stretched. So just because the hips feel tight, because you have that sensitivity in the front of the hip, doesn't mean they're going to respond well to being stretched at this moment. Now, oftentimes people who present with anterior hip pain have associated range of motion loss in hip flexion and hip extension and also hip rotation. But just because we see those impairments doesn't mean we need to address them yet. First order of business is calming down that hip and reducing pain. Then later on we're going to need to address the range of motion, and that's where the end range mobility work will come into place once the symptoms have died down a bit. But what I find super beneficial early on is to address the position of the pelvis first. So oftentimes when people present with anterior hip pain, I tend to find that they rest in this anterior pelvic tilt. And this could be due to a reduction in hip flexion and internal rotation in the hip. So the pelvic position is making up for that with excess low back activity. We'll also assess a toe touch. And with these clients, their low back just simply does not want to round. They have this excess tone in the lumbar spine, and then all of the rounding is happening through the upper back. So the first order of business is to calm down these low back muscles, allow the pelvis to experience a posterior tilt, which will afford more space for the femur to actually flex. So if the pelvis is flexing, and then we try to flex the femur, we'll most often run into a bony block a little bit earlier. And I've addressed this in other videos as well to help improve that hip flexion. But for now, we want to improve the ability for the pelvis to move backwards to create more space for the hip to flex. And you can even try this on your back. You can overly arch the back, bring the knee to your chest, you'll get blocked off early. Flatten the low back into the floor, and you'll be able to flex a bit more with less pinching and pain in the front. So to address the pelvic position, we're going to need to do three things. First is to quiet down these stiff lumbar erectors and get some length through there while we load the lower limb, specifically the posterior chain. Next, we're going to want to actually get some load into the hip flexors while we flex the spine, because hip flexion, as a compensation, will drag the pelvis along with it into a posterior tilt. So once we run out of room in hip flexion, notice how the pelvis will tuck under and it'll force that lumbar spine to round. That's one way of getting that lumbar spine to round, getting the abs involved, getting the hip flexors involved to produce that. And not only will we be getting some strengthening stimulus in the hip flexor, but the ability to create a nice strong contraction in that anterior hip region will significantly help reduce pain in what's called exercise-induced analgesia. So we're getting a pain-relieving effect through exercising these tissues, but we're not doing it in a way that actually flares up the hip and puts stress on that anterior capsule. This is important. And last, we'll address the muscles on the back side of the pelvis, specifically the glutes and hamstrings, to promote that posterior tilt. And we'll introduce some hamstring and glute bridge variations as we work through hip rotation. So let's get started. Okay, this first exercise I call the wall-referenced spinal flexion. So the base variation here, we're just going to work on getting these lumbar spine erectors to relax and improve some lumbar flexion while we get some load through the abdominals and a little bit isometrically through the hamstrings. So I have dumbbells placed against the walls here as reference to drive my heels into. So I'm going to keep a slight knee bend. Think about pulling my knees forward as I isometrically pull my heels into the dumbbells. And then I'm going to also press down into a foam roller with my arms straight to get the abs involved, which assist that trunk flexion. So I'm going to apply pressure into the roller, inhale through the nose, roll down to the base of my quad. Exhale, press back up. Roll down. Think about segmentally pulling each vertebrae off the wall one at a time. Now, we don't want to turn this into a hinge. We want to keep the low back pressed into the wall the entire time, so it shouldn't look like this. Okay, this is feeding into the compensation that we're trying to avoid, which is that overemphasis of anterior pelvic tilt and lumbar extension. We want to quiet down these muscles, not contract them. So once we get comfortable with this, we can remove the dumbbells, do this in a stride stance so we can do it one leg at a time. This will get a little bit more loading through the glutes and quads as we introduce this spinal flexion. Oftentimes when we load the glutes and quads, we want to just do a pure hinge, but doing so with a flexed spine is going to force the glutes and quads to do the work and not the lumbar spine. So we're going to press through the ground and just start going through these half Jefferson curl type of movements. Okay, so once this is comfortable, the foam roller is really nice because it helps guide that segmentation of the spine. We can actually load this up a bit. So keep that knee bent. Make sure you don't have a negative shin angle. The knee is in line with the ankle here. Okay, and then eventually we can come off the wall. But we want to make sure we're really comfortable with that spinal segmentation and we're not turning this into a hinge. As I come up, I like to think about continuously driving my knee forward over the toes, and this will really light up the glutes. We don't want this to happen, where this knee snaps back. And then we're using a little low back to come back up. And you'll notice that the low back is starting to get fried if you do that. So keep that knee driven forward. Okay, this next exercise is what I like to call the single knee to chest sit-up. And it's a great exercise to get the hip flexors working in coordination with the abdominals to not only flex the trunk and relax these lumbar extensors, but also get some load in the shortened range, the compressed position of the anterior hip, which is the sensitive position. This is going to really help reduce some pain in the front of the hip and also help improve that hip flexion. So this exercise is also working a muscle called the rectus femoris, which is a two-joint hip flexor connecting from the front of the hip to the distal part of the femur at the knee. This muscle also has an insertion into the front of the joint capsule, so I believe it's a very important muscle to fire isometrically. We're going to have a heavy object on the bench, and I'm going to place the top of my foot underneath the bench like this, keep my other leg flat. Okay, we don't want to set up so far in hip flexion that we already feel pain in the front of the hip. We could back off a little bit, and we want to have room for the trunk to actually flex. So I'm going to push my toe up into the bench, flatten my low back, and I'm just going to do a little sit-up here. So this is variation 1, where I'm just dragging my hands along the floor, getting my abs to fire while simultaneously firing the quads and the hip flexors. Level 2 is we can actually crunch all the way up and get more into that compressed position. Okay, hold there isometrically, and then come back down. And then we can bring the arms overhead to challenge this exercise even more, and then actually really turn it into a strength exercise for the abs and the quads. Just a few reps of those and my abs really start burning. Now, what's really nice is I don't feel any hip pinching in this whatsoever because the pelvis isn't moving into an anterior pelvic tilt. So we're creating that space for this femur to actually flex. Try this one out for a couple sets of 8 to 10 reps a side, and the front of the hip should be feeling nice. And lastly, we're gonna go over some hamstring bridge progressions because the hamstrings are extremely important to address pelvic positioning because the proximal portion of the hamstring will help facilitate a posterior tilt of the pelvis, which is hip extension. And it's okay to get the glutes involved a little bit with this as well. So first variation, we're going to use a low box, something around 8 to 12 inches against the wall. And we're just going to allow the calf to kind of rest on the box and then place the whole foot flat on the wall. This other knee can be taken toward the chest to help drag the pelvis into that posterior pelvic tilt. Okay, and then we're just going to dig the heel into the box, push the foot into the wall, and hover the pelvis off the ground. Okay, and we could just hold this isometrically. I want people to be holding 45 to 60 seconds before moving on to the next variation. We can even bring this leg straight parallel to this thigh to make it harder. Now the hamstrings have to work even harder to stabilize that pelvis into a posterior tilt because it doesn't have the assistance of this opposite hip flexion to drag the pelvis there. Now to progress, we can move to a lower surface, and I actually like to use a foam roller so that I can place the balls of my toes on the foam roller, and this lengthens the lever a bit more and gets the glutes involved as well. So I'm going to pull my heel up off the ground, engage the calves a bit, keep that posterior tilt, and then lift the butt up off the ground. And again, same progressions. We can hold this knee to chest, or we could bring it forward to challenge that hamstring even more. So the glutes and hamstrings and calves are working really hard. We want to maintain pressure through the inner arch of the foot here. We don't want the foot spinning out like this. This is telling us we're losing hip extension and we're trying to bridge up way too high. So just be very mindful of that position. If we want to bias the hamstrings a bit more, we could just dig the heel down instead of using the calves and glutes. And a progression I really like to use with this foam roller hamstring bridge is oscillating through internal and external rotation. So you could do that with a forefoot bias or with the heel bias like this. Okay, so we're just moving through internal and external rotation, mobilizing that joint capsule in hip extension. And with that posterior tilt, it's not going to stress that front of the capsule. I'll tell you what, most people aren't training the hamstrings in a bent knee position, especially isometrically in the gym. And this is why a lot of them end up with stiffness in the front of the hip, because the nervous system is creating some protective tone in the front of the hip because the muscles that stabilize the pelvis aren't able to produce force. Okay guys, that's the video. If you are struggling with anterior hip pain, I provided a program here with these exercises that you can follow a couple days a week, and give it time and hips should start feeling much better. And if you are struggling with hip pain and you want an individualized program based on an assessment, please reach out and I would love to help you personally through online coaching. But for now, take matters into your own hands, try these exercises out, and let me know in the comments which ones worked the best for you. As always, please like the video and subscribe to the channel, it means a lot.